IBD medication can be absolutely necessary and frankly life-changing, but the question that you need to be asking, is it safe? And if you're worried about the side effects, then you might also be wondering, what can you do instead? Now in this lesson, we're going to cover the 5 most common classifications of medication. We're going to talk with you about what they do and why they're used, as well as some of the pros and cons and the side effects of these medications that you're at risk for, and of course some alternative options that have much lower risk and high rates of efficacy. If you don't know me, my name is Josh Deck. I'm an IBD specialist, medical lecturer, physician's consultant, as well as a scientific strategist and education director for the Root Cause for Crohn's Colitis Foundation. My whole career is dedicated to helping you reverse your gut disease, so your IBD and even severe IBS. And today we are talking about pharmaceuticals, what they're used to treat and why they're used. That's going to be the good, the bad, the ugly, and of course, the alternatives. So here's what we're starting with. The 5 different types, 5 main classifications we'll call them, of medication. I'm going to walk you through what each of them are, what they do. You'll be very familiar with some of these medication names. I'm going to walk you through how they work inside of your body and why they're used. And the 5 I'm going to go through with you here are in order. So depending on where you're at in the order, probably depends on your level of severity or length of time you've had this or how many drugs you've quote unquote failed. They often use that term. I call that medical gaslighting, which we can get into. But here's what I want to tell you now. We're going to go through the 5 types of medications. So the first ones we're going to call these 5 ASAs, also known as aminosalicylates. So these are going to be your drugs, most commonly mesalamine. Now, this one's got a few different names, mesalamine, like acetol, Lialda, Pentasa. It's got different names, but the idea being you can take it oral, you can take it suppository, it comes in a foam, all kinds of ways you can take it. That's the first one. The second one that you're going to see that you may have already used is called corticosteroids. Now, these are going to be things like your prednisones or even your budesonides. These are going to be your corticosteroids, so things like Entocort, Uceris are kind of the trade names we call them, but these are the generic names, the drug under the label. The next, number 3 we're going to put up here is called your immunomodulators. I'll use mods for short. Immunomodulator drugs, so these are your Imuran, that's like your azathioprine, your methotrexate. Okay, so these are modulating or modifying your immune system. The 4th class, these are the scary ones that most of you want to avoid. I hear this all the time when you're talking to me, asking me questions like, I'm scared of these ones. These are the big bad bees. Oops, and I was trying to get clever with my words and couldn't even spell. It's going to be Biologics. I think I know how to spell that word by now. So Biologic, this is your Entyvio, your Remicade, your Stelara, your Humira. And the last one, which is actually relatively new over the last few years and considered to be a bit, I'll say more scary because it is a little bit more unknown because of how new it is. These last ones, this is the 5th class we're going to use here, talk about today, is called a JAK inhibitor. JAK inhibitor, just because of how they work in the different pathways. But this one you'll know as your Xeljanz. Okay, so you got your 5 ASAs, your mesalamines, you got your steroids, so prednisone, budesonide, you got your immunomodulating drugs, so things like Imuran, methotrexate, then of course your biologics, the big scary bees, right? These are your Entyvios, Remicades, Stelaras, Humiras, and then of course we have your Xeljanz. Now this isn't a complete list, these are just the most common ones that I see in my practice. There is a non-stop onslaught of new medications being made all the time. If you see me kind of leaning and adjusting here, I had ankle surgery last week, so I'm just standing on one leg because I'm not allowed to put pressure on it. Here's what I want to talk to you about. I'm going to go through each of these medications. We're going to go through how they work inside your body, what they're doing, and during this entire time, if you think you know what they have in common, I want you to drop it below. Okay? The second you think you know what they have in common, and feel free to take a guess. If you think you know what all these drugs have in common, I want you to put it below. I want to hear from you, okay? Here's the first one, 5-ASA. These block, okay? So they block inflammatory mediators. So there are different things in your body that produce, they signal and say, hey, let's bring in the cavalry. Think of it this way. if you have an accident on the highway, cars pile up, there are signals that go out to call in things like your fire, your ambulance, your police to block down the roadway and help whoever's in danger. Then you have your mediators, which are the ones that are going to be your drivers. You have the actual immune cells. These are your firemen, your medics, your policewomen, whoever's on scene there, okay? So these are taking care of you. These block those mediators. They block a lot of those signaling pathways and say, you know what, don't come. There's an accident on the highway, but let's zip our lip. Let's not tell anybody about it. And they block that signal so it can help control inflammation, okay? That's number one. This is what your mesalamine does. It blocks. The next one that we talked about, number two, these are your steroids. This is your prednisone. This is your budesonide. These ones here, they actually modulate gene expression that is involved in inflammation. So your genetics, we often go, my genetics, it's why my eyes are blue. It's why, my skin is this pale. It's why my hair is blonde-ish sometimes. These are my genes, but there are also genetics that are like active and ongoing. I mean, genes have to keep my eyes blue, right? So what happens, you have certain genes inside of your body, inside of your digestive system. They're responsible for these tissues, and they look at certain inflammatory things. And they go, yep, we're going to turn you up or turn you down. They're the signals that says, we got a fire on the highway. Let's scream really loud or really quiet. And they make that difference. These are the ones that will determine, hey, there's some bacteria here. Let's react to it. These are what your genes are doing on an ongoing basis. They modify this expression and say, you know what, maybe let's be really quiet this time. Let's not make any noise about the accident on the highway. Another thing they do is they inhibit the release of these pro-inflammatory, you'll hear me use this word cytokines, just an inflammatory process. Inflammatory cells and proteins in the body are made all the time, and cytokines is in this umbrella, and so it's one of your inflammatory things. These also suppress your signaling pathways. If you want to get sciencey, you have your NF-kappa B, your AP1s, and they also reduce what we'll call immune cell recruitment. And so these are the cells now, right? We got those signaling pathways. We got the radio. It says, hey, call up the police and fire and call up the paramedics. And then you have the cells that actually come to clean up. That's going to be the workers, your people, your emergency crew. This actually reduces how many you call to the scene. So the reason you're inflamed is your body says, hey, big shout, big scream, we have a problem. Let's bring in the cavalry. And they all show up on scene. They block up traffic. And there's a big to-do. That's inflammation inside your body. You have all these huge signaling pathways and all these immune cells coming to the rescue to try to heal you. This is why you're so inflamed. What these do is they just quiet that down and say, you know what, don't bring the whole army, bring like 10 guys. It's a little inflammation, but it's not a whole ton. So it controls that response, okay? The third one that we're looking at, number 3, these are gonna be your immunomodulators. Now, these are the ones that we just mentioned, of course, your azathioprine or like Imuran, methotrexate, some common drugs there. These reduce the immune cell activity. So again, the firefighters, the police, they say, you know what, do a half-assed job here, don't do a whole lot. That keeps the inflammation down. They also manage that white blood cell activity, and they reduce overall immune activity. So the signaling back and forth, all this stuff is kind of quieted. Right, so it's reducing your immune responses. If you've not caught on just yet as to what all these have in common, let me know in the comments if you know what it is. Okay, so 5-ASAs, they block your inflammatory mediators, your corticosteroids. These are modifying gene expression, inhibiting these inflammatory responses. You have your immunomodulators, which are reducing your immune cells and your immune activity. The next one we talked about here, of course, we have your biologics. And I'm just going to put JAK inhibitors because these are a very specific inhibitory pathway. I'm not going to get into today, but these ones will block something, if you guys like the science, called TNF-alpha. I guess it's going to be a little a. That's tumor necrosis factor alpha. So TNF-alpha, it's an inflammatory thing. And then you have your cytokine inflammatory response. You heard me use that word before. And then these also block and help regulate what we call your T helper cells. If you heard me talk before about TH, TH1, TH2, TH17, TH is T helper. Think of your immune system like an octopus. These TH are the arms. What sort of pathways, we'll say, so to speak, are these immune systems going to be responding on? These T helper cells sort of work in these pathways. And so these, when you have, we call T reg cells. These are T regulatory cells. They regulate how much of these T cells are going to respond. And the T helper cells are part of this process. And so your biologics target some of these TNF responses, and they block some of these immune cell responses or help regulate these immune responses that are implicated or connected to your inflammatory responses. So again, we're going in and saying, hey, rescue guy, don't come. Or hey, you know what? All the fire crews come in, all the police and paramedics, let's just turn those down or shut them down entirely. So that's what they're doing. What do these have in common? These 5 types of drugs that we just talked about, right? Your 5-ASAs, your steroids, your immunomodulators, biologics, and JAK inhibitors. What do they have in common? Spoiler, if you haven't guessed it already, last chance to put it in the chat. They block inflammation, or they suppress the immune system. That's what they have in common. They stop the response. But let me pose a question to you. Do you want to stop and block your responses to the problem, or do you want to fix the problem? Let's go back to my favorite example. This marker here is going to be my nail. I'm going for a walk. I step on a nail, goes through my foot. Now that nail's stuck inside of my foot. What I need to do now is go, okay, do I want to block my pain response to that nail, or do I want to pull the nail out of my foot? This is the question we need to be asking. Now, unfortunately, as you know, you're told it's a genetic, autoimmune, idiopathic, meaning no known cause type condition. So all you can do is block or inhibit. If you believe that, of course, that's your only option. We're going to talk about this later. What they have in common is they block it. Now, here's what I do want to ask you. If there was a laundry list of side effects for these things, in fact, I took the 20 most common drugs that are used and I actually compiled a list of the side effects. That's what this thing back here, this big long paper is back here. I compiled a list of the side effects of the 20 most common IBD medications. How many side effects do you think there are, different unique side effects, across 20 of the most commonly used IBD medications? Now's your chance. Okay, 3, 2, 1. This paper here is 3 full sheets, nearly 3 full sheets at 12 font, double-spaced, standard print. 3 full sheets. I don't know if you can see that there. There are 70 different side effects. 70. The most common ones that we see on this whole list across the board are things like nausea, diarrhea. Well, you got IBD. The vast majority of you are not constipated. You're dealing with diarrhea and already some nausea, inability to eat. Other side effects you get: abdominal pain, headaches, fatigue. Give me a hands up, give me a thumb up if you have abdominal pain already, if you already got headache or already got fatigue. They can also run the risk of causing rash or skin infections. Let me know if you've got one of those already. It can make you susceptible to other infections inside of the body. Well, Crohn's disease and fistulas go hand in hand. You've already got infection risk. They can cause fever, joint pain, even weight gain in some of these. Now, these are not uncommon side effects for bowel disease. Weight loss is a bit more common, so there's your outlier. This 3-sheet list, these are all the possible side effects. So if you're worried about some of these, I don't blame you. I would be too. And so we're talking about what can be done and other alternatives to maybe working to get yourself better. We're going to give you some options here that you can use that are highly anti-inflammatory. They work on a lot of the same pathways, these gene regulation, these inflammatory or cytokine or TNF responses. They operate a lot of the same pathways. Now, I will preface, there is a time and place for medication. I am not anti-medication. I like to use medication to bridge the gap from where you are right now, which is inflamed, having a diagnosable disease condition, and ultimately a completely altered or destroyed quality of life. These can be wonderful to take you from where you are to getting your life back, but they are a band-aid. If I have this nail in my foot, it is numbing cream for the pain. It is not removing the nail. That is ultimately our solution. However, in the meantime, to get some relief, more natural, with little to almost zero side effects on these, I'm going to give you a nice comprehensive list of things that you can start using to give yourself some inflammatory relief. They won't work for everybody, but then again, medications, these immunosuppressives, need to be 30% successful in clinical trials to actually pass and be given to you at the tune of $10,000 to $20,000 a month. So, pick your poison, okay? So here's what we're going to look at. And I find these extraordinarily effective. And again, 300 plus clients we've helped now reverse. I've seen thousands of clients on these types of supplements over the years in different careers. So the ones I'm going to give you are highly effective. So the first one we're going to look at is called PRMs. These are pro-resolve mediators. You'll get these as extracts out of omegas. But they are extremely powerful and they help mediate some of these inflammatory responses. They are a bit more expensive, especially for high quality. I can put a link if you ask, and if you're on the podcast or on the YouTube, I'll put a link below and you can get access to that. There is a shot that we can get you 15% off from one of the best companies. It's called Nutridyne, and we have a good working relationship with them. But PRMs are pretty expensive, but worth it. In fact, I recently gave them to a client of mine who was going through an active flare. She's like, I'm flaring up, don't know what to do. I said, great, take these PRMs. Problem solved. Did not flare because they're that powerful. The next ones we can look at are going to be things like Boswellia. Again, this helps regulate the immune response, typically very safe. Another one, which isn't, I'd say it's kind of a medium price supplement, is called butyrate. These ones, I think Body Bio actually sells them. You can get either sodium or I think it's a calcium butyrate. Doesn't really matter which one you use. But butyrate is actually a short-chain fatty acid. It's made by your gut bacteria and it has anti-inflammatory properties. It actually helps repair and sort of build up that gut lining. It can help modify and modulate those immune responses. It can be very powerful stuff. But sometimes the dosing you need might be anywhere from 2 to 10 times the bottle. So you might blow through it pretty quick. But again, for acute use, if you're worried about flaring, butyrate can be extremely powerful. The next one you can use is CBD. I will put a slash for THC, though it's a CBD that's been studied because of the cannabinoid receptors inside your body. You have them in your gut, your groin, your brain, your eyes. They're all over your organs. They're very, very powerful cannabinoid receptors in the body. And so CBD can do that for you. And often combined with THC. Now, some people feel a bit buzzy. They don't like the feeling. That's okay. If THC bothers you or you got to drive or work and can't test, make sure it's a pure CBD. But as a pharmaceutical note, if your doctor is open to it, something CBD actually pairs extraordinarily well with is a drug called LDN. You might be familiar. It's called low-dose naltrexone. Naltrexone is what they use in the ambulance. They'll use this in hospital for anybody with like an opioid overdose, but they'll give them 25 or 50 milligram injections. Low-dose naltrexone, there's even ultra low-dose naltrexone. You'll go 0.2 to 0.5 milligrams up to about 5 once a day, typically in the evening, and it pairs really well with CBD. Now, LDN, your low-dose naltrexone, is a pharmaceutical. It typically has to be compounded, made in a pharmacy, but it is pennies to get. It's actually a very, very cheap drug. So it's very, very easy to access for the most part if your doctor is willing to play with that dosing. But it can give you weird dreams, has some sides. You do have to really go slow, and I'd work with a practitioner who knows what they're doing. So these are a couple here. Let me continue this list for you guys. So the next one we're going to be talking about, this one's kind of a gimme, is going to be aloe vera. Now, aloe has great properties. And in fact, I'm just going to put this up on the board here with the other one I like to use called slippery elm. It is actually the inner bark of an elm tree that's all ground to a superfine powder. It is a soluble fiber, so you mix it with water. I wouldn't take the capsules. The capsules aren't enough. You get a nice bag of the bark, like an organic slippery elm bark. I know Organic Traditions has one on Amazon, at least in Canada. But this bark, you'll actually mix it with a little bit of water, and you mix it with a spoon until it sort of makes this runny, sort of snotty type of texture. And you just take a teaspoon of that mixed with water, comes out to about a tablespoon or two, and you take it 30 minutes before a meal. It helps coat. So think soothing and cooling. It helps coat your insides, your intestines. And the aloe vera, soothe and cool, but they're also what we call mucogenics. So think about if you're wearing a pair of shoes, you're gonna blister if you don't have a sock. This is the sock. If you don't have a lining inside of your gut, and you probably have a compromised lining for sure if you've got bowel disease, but these help rebuild that and structure that and kind of soothe and cool at the same time. They can be very beneficial. And again, I've not seen any negative side effects unless you take too much aloe at the same time, and it might run through you and cause some diarrhea. But making sure you're getting not the preserve, not the flavors, not the juices, but it's gotta be like a nice, pure, preservative-free aloe vera. Pressed would be really great. That's the next one. So I talked about these last week. I will use caution here, because I cautioned last week, literally last week, I was like, hey, maybe don't use probiotics because there are some that are high in histamine. Many people dealing with IBD have high histamine or histamine issues. It's what we call, remember that word TH, T helper cell? It's a Th2 immune-mediated response. This means the Th2 pathway that deals with immune responses like histamines, allergies, these types of things. It is modifying your immune responses to make them a bit hyperactive. And so probiotics, some lactobacillus, your L probiotics oftentimes can be a bit higher in histamine, but honestly, go to ChatGPT and say, hey, give me the top 10 most popular strains of probiotics that are good for my IBD that are low in histamine. ChatGPT will do the work for you. It's a great way to go about it. So probiotics can help build that back up. They produce a lot of good byproducts like that butyrate we talked about earlier, these short chain fatty acids. They can create signaling molecules and they send messengers to the body to regulate your immune responses. So they're not up here and super active, but instead they can really calm them down. We're keeping that signal quiet because these probiotics can create that response, which is really beneficial. I'm going to give you 3 more here. The next one is going to be curcumin. Now, I would get a nano curcumin. That is a poorly written word that says nano now, but that's all right. Nano curcumin or liposomal form. Again, Nutridyne does have this available, I know, but curcumin by itself is not super bioavailable, but it can be, again, extremely anti-inflammatory, help modify that immune system. Go slow. I've seen some people have negative responses, though it's rare, but typically can be well tolerated. But in the nano, and there's one on Nutridyne, I know it's called Curcumin 400X. I think it's like this nice lemon flavored liquid, but again, very absorbable. And that's what we want to do. So you want to get the nano version, otherwise you're probably not going to get the benefits. There's only 2 more I'm going to show you here, which are, again, extremely anti-inflammatory, can be very potent, help with blood and help control some of these. The first one, vitamin D. Vitamin D is almost classified as a hormone. It's a vitamin, but it operates very similarly to a hormone, and it is implicated hugely in immune deficiencies, low levels of vitamin D. Now, oral dosing versus IV is different. Get sunshine where you can, of course, but supplementing vitamin D, sometimes 5,000, 10,000 IUs a day for short stints or long term, get your levels checked, can be extremely beneficial. And it's one of the greatest immunomodulators we actually have. And you can produce it by simply going into the sun, or you can buy it for relatively cheap. I'm just very careful about grocery store vitamins, so your Jamesons and other cheap brands. You get what you pay for. So make sure you're getting a nice brand, and typically a liquid. I avoid hard tablets. They're basically just expensive pee. The last one I will talk about here is going to be Qingdai, also known as Indigo naturalis. This is a Chinese herb, not well regulated, so hard to get a nice quality, but has shown in many people to stop bleeding in like hours. Some it's a couple of days. However, long-term use can be hard on the liver and kidneys, so you want to watch that, but it can really help manage some of those responses. Now, I want to ask you another question. We've gone through so far, we talked about the types of medication, right? We talked about what they have in common. They block inflammation. What do medications and all the supplements I just gave you have in common? They all manage inflammation. Everything I gave you is an alternative to some degree to medication. Are they perfect? No. Are pharmaceuticals typically stronger? Yes. Do they have a laundry list of 70 different side effects? No. All these ones I gave you are almost guaranteed to be perfectly safe, provided you follow the manufacturer recommendations. Very few people have any sensitivities. However, we know if you're taking all these herbs and these vitamins and minerals and plants to manage your symptoms, what do you have? You have plant-based medication. And that's something I want to be very careful about here. So the goal isn't so much to just cover the symptoms. However, if you're going, you know what, I don't love the symptoms or the side effects that I'm getting from my, especially low grade. If you're on biologics already, you're probably in a pretty severe state. But things like your corticosteroids, so prednisone, budesonide, etc., mesalamines, a lot of the time, these can just be modified by getting onto some of these other simple plant-based. But the more severe it gets, the more severe intervention you need. So again, I want to bring this analogy. You step on a nail. You go to your doctor. He looks at you and goes, it's a pretty bad looking nail. It's infected, it's inflamed, but it's part of your body now. There's nothing we can do. So I'm going to give you numbing cream. I want you to take it for the rest of your life. And if it doesn't help, we're going to cut off your foot. You'd punch them. And that doctor would lose their license. Guaranteed, that's medical malpractice. However, when you go from being healthy 10 years, 20, 30, 40, 50 years, and out of the blue, boom, you have a bowel disease. Your doctor looks at this and goes, yep, it's just part of your body now. There's nothing we can do. I know it sucks, but here's medication. Take it for the rest of your life to manage your inflammation. And if it doesn't help, we can do surgery and cut your bowels out. Why is that not malpractice? Why are we not looking at the root causes? Now, I did last week a video on some of the primary infections. It's multi-layered, but these are reversible conditions. We're in the middle of publishing the research. They can be fixed, but we need to know the root causes. So I'm going to go over 3 really important things here. If you heard these before, listen again, because this needs to be hammered into everybody so you can become your own advocate. I want you to advocate for yourself to your doctor. I want you to have the tools to go to your doctor and say, hey, this doesn't make sense, explain it to me. They'll probably fight you, they still fight me on it, but you have the power, whether they like it or not. So here's the first thing about it, right? Here's the 3 things they say, the 3 legs of bowel disease that are unavoidable. The first one is that it's autoimmune. It's just happening to you. And I'm going to go through these pillars. I want to knock the legs out of this table one by one. It takes about 2 minutes to do. And this is the best tools I can ever give you. Number 1, we say it's an autoimmune condition. Well, did you know that only 70% of any UC case has any antibodies at all? And it's 60% of Crohn's disease have antibodies, the most common ones. Okay? The rest, it's like 50% of Crohn's, and the rest of UC and Crohn's like 5 and 10%. So there's very little prevalence of antibodies. Now you hear the word antibody, you go, oh, my body's attacking itself. No. There are 2 kinds of antibodies. There are antibodies which are very special targeted soldiers for a specific invader. So if you have a border and you get foot soldiers coming across from a distance, what do? You create snipers, a very specific unit. It's not good against a tank, but it's great against that one specific foot soldier. On the other hand, you also have autoantibodies. That's when the sniper turns and starts attacking your own people. So there are 2 antibody kinds. One is an external, it's just an antibody. The other is an autoantibody, which attacks your own tissues. Every single, the top 10, I'll say, most common antibodies from 70% to 5% of the time that are prevalent are some are autoantibodies, not all, very few are, but they're also just antibodies. They react to the 3 most common infections that I see, like fungus and mold and parasites, those types of things. So we have to ask, is it really autoimmune? Even if they were all autoantibodies, what if you're part of the 30 or 40% and your doctor's treating it like it's autoimmune? Shouldn't we be asking for better? Should we not be asking more questions to say, why am I autoimmune? Where are my antibodies? Show me the blood work, prove it. And then when you have the antibodies, if you do, prove that they're attacking me. Are these autoantibodies, or could they possibly come from something else? So this is table leg number 1. Knock that one out of there. Damn good chance you're not autoimmune. Okay, that's number 1. Number 2, they will tell you now, okay, it's autoimmune. The next one they're going to tell you is it is genetic. Well, most of you don't have any family history. Some of you do, and that's okay. But did you know genes are not responsible for your disease? There is no gene across the board that causes bowel disease. Doesn't exist. There are genes that are associated with bowel disease. Approximately, between Crohn's and colitis, 20 to 25% of all cases have a genetic association. So what I'm telling you right now is your doctor said you have an autoimmune condition, which probably isn't. It's a genetic condition, which is only implicated 20 to 25% of the time. So 75 to 80% of you listening or watching right now don't have any genetic correlation whatsoever. But also keep in mind, genes do not operate in and of themselves. They are influenced by external factors. Infections, stress, sleep, chemicals, toxins, microbes, nutrients, they all program your genetics for what they do create and how they respond. You have genes that actually turn over cells inside of your body or intestines. You have genes that react to certain microbes. You have genes that produce and regulate inflammatory responses. So if you put bad inputs into your genes, you're going to get bad outputs, but we're blaming your genetics when it's probably not. That's table leg number 2. The next one I'm going to bring down for you here. We say the word they use is idiopathic. So idiopathic, it also means unknown. We don't know what's causing this. Well, let me tell you something. Looking at the data of all the cases, you can actually verify this with the CDC, the Lancet, whoever you want. You can go back and check this data. In the 1950s, oops, that should have been 1950s, okay? There was 15 per 100,000 people had a diagnosed case of Crohn's or colitis. Today, we're going to go from the 2020s onward. That's 463 per 100K. That is a 3,000% increase in 75 years. You're going to tell me there's nothing causing it, that it's random and just God plays favorites? I call bullshit. So you have 3 legs: autoimmune, genetic, idiopathic. They don't exist. And you now have the tools to go back to your doctor and say, wait a minute, show me otherwise, treat me otherwise, test my antibodies. I have questions that I demand answers. The toolkit they have, unfortunately, doesn't always provide those answers, but they are out there. So if you are actively looking for answers, this is making sense. And if for the first time you're watching this and you're going, you know what? It's been 15 years, 20 years I've been dealing with this. And for the last 20 minutes, for the first time, this finally makes sense. Here's what you can do. If you're here on the YouTube, if you're here on the podcast and you're listening or you're watching, all you have to do is check the link below in the notes. And there's going to be a link there, an email there as well. You can email me directly. You can schedule a call with me and the team to see if this is a good fit, to see if we can help you. Because I'm telling you, it is not this lifelong, this death sentence. And you can fact check every single thing I've told you here. Feel free. In fact, you want to take it, run it through a transcriptor and run it through ChatGPT and ask it, for example, is anything about this wrong, medically inaccurate? And you'll see very, very quickly. Ask your doctor. Bring the stuff to them and say, hey, I was told it's not necessarily autoimmune, genetic, or idiopathic. Saying that I may not have any antibodies, let alone autoantibodies. I may not have any genetic correlation, and genes don't cause my disease anyway, and cases have risen 3,000% in 75 years. And they've doubled over the last probably 30. So it's this exponential growth. What's happening? Because you're telling me there's no cause, but something has to be. Can you give me answers? If they can't, talk to somebody else. Feel free to reach out to me and my team, because we'd love to have that conversation with you to show you what's possible. Please feel free to share with anybody that you know, that you love, who's dealing with this, who needs the help. Until then, we'll see you next week. I'm going to hop out of the frame here.